Welcome back. My name's McKenna,
And I'm Bree.
and today we're talking about grad school.
A very fun time of life.
Yeah, it's going to be a great happy episode.
Audie
Hotties.
Hotties. Yeah, welcome to the Audie Hottie podcast.
Here we are.
Mm.
So, Bree, any updates for the week?
Let's see. The time change happened.
Yes, it did.
And normally I'm not that affected by time changes. Usually it's like, a day or so or whatever. Like occasionally I'll just be like, oh, I have to change my clocks. What? But
Right.
this time change hit me so hard. I don't know what it is. I feel like a pile of mush.
Yeah.
I took two naps on Monday after the time change. I
Wow.
took one and I set alarms for myself because if I nap longer than like 30 minutes, I'm a monster. I'm just like so groggy and horrible. Like
Oh
I wake up angry.
no. Do you just feel like your body's still asleep, but you have to be awake?
Kind of,
Yeah.
yeah. Or like I also have what I call crack dreams when I do that. Like
Crack
yeah,
dreams.
I call them crack dreams because it feels like my brain is like if I have regular dreams at night, they're usually like they kind of make sense. There's a storyline. Like it sometimes involves real life things, sometimes doesn't, but it kind of like makes sense. Like it's like one long dream.
Interesting.
And when I had nap too long, or sometimes when I'm sleeping occasionally, but when I nap too long, I have these crack dreams that just feel like my brain is like going wild. Like it's what I imagine being on drugs would feel like that, but I've never done that hard of drugs.
Dreams.
I wake up and I'm just like, what the hell happened?
Oh my
And like
God.
my poor body is so confused about the world and like where I am, and like sometimes I don't know where I am, and like it's very stressful.
That sounds really disorienting.
Yeah, so I usually set an alarm so that I don't sleep that long. But I slept for like 30 minutes and then got up and like Lauren and I went on a walk. I finished some other work stuff. I like came back to my room and I was like, I need to go lay down again.
Wow.
I took another 30-minute nap like in the
Oh
same day.
my God.
Am I 50? What's happening?
It hit me really hard too. On Tuesday and Wednesday, I feel like I woke up and my eyes were still like glued shut. They could not open. And I had my coffee. I remember both of the days I had coffee, but I felt like I was sleepy or sleeping the whole day at work. It was
Oh my
really,
gosh.
really jarring. And I was just like, why the fuck am I so exhausted? And like, yes, I could blame it on several different things. Like time change, that's probably why it is. But also, I'm on some new medication, so it could be because of that. And then the
Mm.
third thing is that there was this huge lunar eclipse this week, full moon
Yeah,
lunar eclipse in Virgo. And so
I was gonna ask
tons,
if that was
yeah,
it.
tons of energy around this full moon. And full moons bring energy of their own, and eclipses are kind of like it's just interesting because full moons kind of illuminate what's going on in your life, and
Oh.
then eclipses kind of bring that to a whole other revelation, clearing. So it's just a lot of messaging this week or
Mhm.
downloads if you kind of think about, I don't know, if you relate to that. I wonder if this week has been giving you some more information. For me, I feel like I have just I've been reflecting a lot and thinking about what's next a lot, and it's like I'll just have random things popped in that I haven't thought about in years, and
Oh.
like it's as clear as day. So it's exhausting though.
Yeah, definitely. Yeah, I'm going through a phase where I'm like getting back on doing things that I should be doing. Like I fell off of my skincare routine, I fell off of my supplements routine. So I'm trying to like reordered some things that I was missing and like started it over again.
Yeah,
Um,
like a big reset.
yeah,
Yeah.
which I've been telling myself to do for months, but
Yeah, I
now
mean,
is just the time.
now you're ready.
Yeah.
Yeah, no harm, no foul.
Yeah.
And that's kind of like a big part of the messaging of this astrological event is that it's a big signify of endings and beginnings. So,
Mm.
and it kind of works in with the spring equinox coming up next week,
Mm.
like the beginning of spring. And I know that we talked on our New Year's episode about how like it's not really like New Year's isn't really the time of year that the year starts over. It actually is in spring.
Yeah.
So maybe getting ready from like that transition from winter to spring, hibernating to living again, and
Yeah.
all the things. So
Mm.
again, there's a lot of reasons why the exhaustion is just dialed up this week, but I resonate with you. I hear you.
Yeah. What about you? Any big updates this week? Mm.
Not really. I mean, I was yeah, really tired this week. I went out to the coast yesterday, which was really
Mm.
fun. And just I really want to be doing more day trips like that, where it was just so easy to drive an hour and a half, get there, adventure around, with my good friend. And I really feel like something that has really stuck with me this week, but also was kind of starting the week before, was just kind of pouring into self-care
Mm.
by way of friendships and just like
Yeah.
making sure that I'm like spending a lot of quality time with friends and prioritizing friendship because I think it's really easy for me to isolate and think that I need
Yeah.
quiet time when in reality I need human connection. Like
Mm.
even last week when I came over and we played that really fun game. I don't know.
Cascadia.
Yeah, it's so much
We just
fun.
taught our friends Marla and Avery that last night.
Yeah.
Yeah, so now we can play with even bigger groups.
I love it.
Yeah.
Yeah, playing games is such a great way to connect because it's just not, you're not talking. I mean, you are talking like amongst the game, but it's
Yeah.
not
It's not
like,
expected that you talk the whole time and like you just
yeah,
kind of focused on something else other than just the like eye contact or whatever it is. Yeah.
exactly. Exactly. No, it's so finding ways like that to connect with others. Going to the coast with my friend yesterday. On Friday, I went and did an errand with one of my good friends, and we just had like a really good conversation about friendship and how friends come and go in life. And it's kind of special to have those kind of grow with you and continue on because
Mm.
that's not really, I think it's such an expected thing in our culture, but it's not really realistic in our culture
Yeah.
either. Like, I think it's this hidden expectation of, you're friends with your childhood friends forever, and then they're your bridesmaids in your wedding or whatever,
Yeah.
whatever your
Mm.
trajectory of life is. And it's interesting to kind of look back on friendship like that. So anyway, I don't know. That's what I've been thinking about the last couple of
Yeah, I think that's really
weeks.
accurate too with our current culture of like everyone moves so easily and like we don't stay in the same places like we used to before.
Yeah,
Yeah, makes sense. It's gonna be really hard.
exactly.
Like a lot of our friends right now are moving away, which is tough. It's just like time of life that they're moving, but like
Yeah.
not for any good particular reason, but just everybody happen to have a good reason right now. Um, Yeah, and then I was also gonna say with the trips thing, I struggle with that too because I tend to like get a little frozen on getting out of the house and doing something.
hmm
So that like, oh, but it's gonna take so much work and then I
Yeah.
go. But really it is like that easy once you get there.
Yeah.
It's just finding that motivation to like get yourself to the first step, make the plan, and just go.
Yes, exactly.
Mm.
And I don't know how many times you've been to the coast, but I always kind of expect it to be the same every time. Or like
Mm.
when I'm planning a trip to the coast, I'm just like, oh, I've already seen everything, like
Mm.
whatever. But even if I've seen it before, it's always a completely different experience. So even honoring that part of things and
Yeah.
understanding that, like, oh, just by going out, I literally just get to breathe in the sea air. Like
Hmm.
that's enough reason to go. And I think I have so much personal expectation on like adventuring and hiking and seeing new things. And it's just like, actually, it's okay to just have a different day. And even if it's doing the same things, it brings
Yeah.
difference
Or
in.
a half a mile hike to get to a viewpoint, or
Sure,
yeah, like it doesn't have to be
exactly.
some achievement or
Yeah.
yeah.
No, that's so true. So true. So anyway, that's
Yeah. Speaking of achievement,
Speaking of
Today,
what achievement? Oh,
today,
you're
today we're talking about grad school
yeah.
and pressure of achievements, I'm sure.
Yeah,
So,
it's a
yeah, your memories are a lot more fresh than mine.
yes.
Like, as we've talked about, I've been out for 8 years and you've now been out for 1 year. You got your one
Hmm.
year
Crossed by 1 year.
celebration. Yep.
Hmm.
So I'm curious to see like what your thoughts are with it being so recent for you.
Yeah, and like I don't know how the conversation's going to go today. I thought about it a lot on my way over here, and like grad school was a very traumatic experience for me in a lot of different ways because of being ADHD. So
Yeah, I have a fun story about it, but we'll get
great.
to it.
I'm super excited
Yeah.
to hear.
Mm,
So like I told Brie, I was like, I might cry again because that happened last week. But also I was like, what perspective do I even want to take today? Because I don't
mm,
just want to sit here and like talk about grievances
mhm.
and whatnot. And so yeah, on that note, I just have no expectations for how today is going to go, and I hope that there's some like delight and happiness that shines through, but I can't, there's no promises. It was like a really difficult experience for a lot of reasons. So,
Yeah.
but I wanted to start off with, yeah, like you did go to grad school. It was 8 years ago.
Yeah.
So what was your like collective experience like? Was it positive? Was it negative? Just like generally.
Mm. Oh gosh, that's hard. I feel like there's different categories within it
Hmm.
of like my social experience
Hmm.
was pretty positive.
Cool.
There was only one other queer person in my program.
That makes it
So
easy.
of course we became friends. We still are friends. Shout out to Hillary. Um, as far as I know, I mean, you never know who else might be, especially in the South, but so we had a pretty small class. I mean, there was, I think, like less than 60 of us in
Hmm.
our
It was
class,
like
and then
us
we're
too.
split between two campuses.
Okay.
So I think there was about 40 people in the area that I was in. But we made some like really solid friendships and like people that I do still talk to. And one of my favorite things that I miss all the time was we would go to coffee shops to study because
Yeah.
you didn't want to be in the library all the time
Right.
or in the school rooms all the time.
Yep.
So we'd spend like some days with like 6 to 8 hours in a coffee shop.
Yep.
And I really kind of miss that. I miss like having like study time with my friends and like just hanging out with our coffees and the beginning of a bad coffee habit. Which I didn't really drink coffee until grad school. I drank
Funny.
during finals in undergrad, and it would like jazz me up for like 20 hours. Like coffee did so much for me back then. But now, yeah, coffee doesn't do much anymore. Grad school ruined that. So I had so much coffee. But I really enjoyed that like experience of it. And even now if I drive past a coffee shop or something, sometimes I'll be like, oh, I remember when. Like
Oh, do you not go usually to coffee shops now?
I do, but I don't have as good of a reason. Like I do
Okay.
like hang out and like do a little bit of work for a while, but
Yeah.
like, it's not the same as grad school was such a like intention driven thing. Like it was like we have something we're working towards all the time.
Yeah.
There's a test to study for, there's anatomy to do, there's
Right.
whatever. And so it was always very like you could spend that much hours and not even realize it.
Yeah, and there's kind of like
Mm.
a nostalgia and almost like a
Mhm.
holding place of just like you are at the coffee shop for 6, 7 hours and you're just working on one thing and you're with these friends that are st like going through the same thing
Mhm.
as you. And yeah, there is a very um like special experience with that. And I definitely agree with you that like that was something that both undergrad, post grad, like post undergrad, I guess I want to say. How do you say that?
Grad
Undergrad. No,
and grad school.
no, because I was in, it's not what I'm trying to
You had like
say.
an in between.
I had an in between. I was at PSU for about a year and a half doing
Mm.
classes to do prereqs, post-bac. That's what it's called.
Oh,
Okay.
postdoc. Yeah. Okay.
So from my undergrad to post-bac to graduate school, I would say that coffee shops were definitely like the enjoyment
Hmm.
of it.
bringing
And
that
see.
a little bit of comfort and joy
Hmm.
during strife type things and like that
Yeah.
community, a community where you're in the struggle together. And yeah, so that
And
part was really nice. The school aspect of it was not
like academics.
academics,
Okay.
yeah, because and I don't remember if we've talked about this before or after this one comes out, but um with my homeschooling, I didn't take tests until I was in high school. And through high school, I like kind of sort of learned how to take tests. And then, undergrad was a little bit different, and then grad school was completely different.
Yeah. Super intense.
Yeah, and so I was really frustrated the whole time because I was studying my ass off. Like I worked so hard, like round the clock, trying to memorize things, make different study guides. Like I was the person that was doing everything,
Yeah.
and I still would test in like C's, sometimes B's, an occasional A. And my professors were always like trying to support me and ask because it's a small program, so you have lots of support. But they were always trying to be like, why, when we do a lab portion, can you answer every question on the dot, perfect, do all the lab studies, all of that, and then you go to the classroom and you get C's? Like, what's happening? And I was like, I can't take tests like this. I wasn't taught like from a young age how to do tests, and then the pressure of testing and just the way that things were worded and all that. It was really hard for me.
Yeah. Did
Mhm.
you have any sort of, because you weren't diagnosed with autism until years later.
Yeah.
Now, looking back at your grad school experience and your testing experience, I guess I should say, do
Mhm.
you feel like it was difficult because of your ADHD?
Definitely. I think like overreading into questions and not really understanding like the way that something was being asked, like kind of like we brought up before, where you like bring up the would you rather. And then you're like, I have like 18 follow-up
Yeah.
questions. Like that's how I would feel on a lot of test questions. So I would
Okay.
take so long to finish them because I was trying to sort out like, okay, do I answer it based on the simple answer, the stupid answer, like we covered before?
Yeah.
Or do I answer it based on like this book knowledge answer? And then like the part of my um like strong ethics and strong justice orientation is like if there's an error on something and they refuse to correct it or do something like that, that really, really bothers me. And so sometimes I couldn't get past a question because I'd be like, this is wrong. There is no right answer.
Oh,
And like where
yeah.
most people would just be like, well, it must be an error and like skip past it, I
Yeah.
would get really hung up on it. Um, and then the biggest thing for me was just the stress. Like stress in general pushed my symptoms of everything so high.
Yeah.
Yeah, like I guess I can tell my story now of what happened with me, but when my stress was at its worst, like in the second year out of three, I actually started having a lot of physical manifestations of my symptoms. I started having like crazy dizziness. I was falling in the morning, like I would get
Mhm.
up and just fall back down wherever I was. I was at a clinical rotation and fell once like onto a plinth. Like luckily I never hurt myself
Yeah.
falling, but it was like uncontrolled, just like
Yeah.
weirdness. And then like gaps in my memory, a ton of joint pain, like
Hmm.
everything hurt all the time.
Hmm.
Um, and of course, we're learning all about it at the same
Right,
time. So then
right.
I'm like, okay, here's all
What
this
is
knowledge that now
happening?
I'm like, oh my God, that's me.
I don't want like this type of tactile learning. I
Yeah.
just want to like read it. I don't want to
I
feel
don't want to
it.
be it. Yeah. And so I actually had one of my professors check me out because I was like, well, if I'm having like joint problems or something, like I want to know like what's going on because I had had joint pain most of my life in some degree.
Yeah.
So I was like, if it's like arthritis or something like that, I want to manage it. And he checked me out and did a bunch of the like following tests and like checking my neuro, make sure everything there was okay. And like my reflexes were all messed up. They didn't respond how they were supposed to. And he was like, I don't know. He was like, you really like you have some concerning things that I don't know. Like it's not a pattern. It's not a cluster of like one thing that I can tell you.
Sure.
Like this is what it could be. But of course that freaked me out.
Yeah.
So I actually well, I tried to get imaging through my like primary doctor, but they were like, we can't do that really. So I ended up going to the emergency room and got a CT. And then the CT was inconclusive, so then they did an MRI. and they ended up just diagnosing me with ataxia, which is
Yeah.
just like an off balance walking disorder,
Uncoordinated.
uncoordinated walking problem. Yeah. Which is basically like they didn't see anything. But
Right.
my family has a history of brain cancer.
Oh, wow.
And one of my classmates got diagnosed with MS while we were in school. And
Wow.
so my poor little brain was like, oh my God, what's happening? And why am I
Yeah.
falling? And like uncontrolled movements.
Yeah.
Yeah. So
We're
I went
going down one
through,
by one.
yep. So I went through all of that. And I'm pretty sure that it was like literally just the symptoms that I already had, but the stress pushed them so high.
I
Mm,
mean, do you think it was some sort of autistic burnout?
I definitely was burned out like most of the time that I was in school
Yeah.
and after.
Yeah.
Um, but I think a lot of that, well, yeah, I don't really know. I guess burnout for me usually results in like more disorganization in my thinking, fatigue, like difficulty planning things. But it usually, I don't feel like burnout really ignites my physical symptoms as much. Usually, what ignites my physical symptoms is being overstimulated. Like, especially if I've been like working a lot or something like that, then I get the loss of balance, running into walls, like joint pain,
Right.
like all of that stuff
Right.
more. Mhm.
So it just sounds like you might have been like overstimulated a lot
Yeah.
constantly. And whereas burnout, you feel like it's more of a mental thing and not more physical.
Yeah,
Okay,
I'd say so. Mhm.
cool.
Yeah. All right, well, that was basically my
That was
experience.
your whole
That was basically my whole
experience.
experience. Yeah, and I just by the end, I was just so frustrated that I was like, I am an A student in my head, like the knowledge that I know and the way that I have studied and practiced and worked. I'm an A student and I was not getting the results that I had worked for. And that was very frustrating to me when
Yeah.
there were people that seemed to like study some, but not very much, and were
Hmm.
kind of like relaxed and like whatever about it. And then they would flying colors it.
Right.
And that was really frustrating.
Yeah, you were
So,
working really, really hard and not
yeah.
having the results that you wanted.
Yeah. And that's
Yeah.
the same kind of like recognition problem once you're out in our careers,
Hmm.
is that there's not really upward mobility, there's not really like, feedback that you're doing great at whatever you're doing, or
No,
like
there's zero.
unless you want to be nationally recognized by writing papers and going to conferences and putting on presentations and research and all this like very energy consuming stuff.
Yeah.
Like you don't really get recognized for anything.
Do
So,
you wish that you had more recognition now?
um, yeah, I mean it's the problem is that with a people fo facing career, like there's just not a lot of feedback. Like
No, yeah.
I don't really care if it's good or bad feedback so much. Like of course the bad hurts, but
Yeah.
I just want some kind of like knowing how I'm
Yeah.
doing. And most people won't tell you that like to your face. They're not gonna say like, "Oh, you're doing great. Thank you so much for all your help." Like
Yeah.
sometimes you'll get that, but it's
Right.
pretty few and far between.
Yeah.
So,
Well, especially
mhm.
in working with families, I imagine that like they don't really know.
Yeah.
They have nothing to compare it to. And then
Yeah.
same thing with older adults, like they just probably have never been in that position either, where they're working with a lot of other professionals or like
Yeah.
have any knowledge of what's going on too.
Yeah.
Yeah.
Well, it's not like we tell our like doctors and stuff like that. There's no expectation that you're like, great, you did great work today to your doctor or
Okay.
anything. We don't have a cultural setup for that.
But I do actually have like something to say about doctors. Have you
Okay.
watched The Pit on
Uh-uh.
HBO? Okay.
Mhm.
I'm obsessed. It is this new like medical show on HBO. And one of my really good friends is a no, what is she? She's a physician's assistant in
Mhm.
the ER. And she was in the emergency room as a provider during like the quarantine, during the
Oh.
whole pandemic. She's worked for so I have had a very like different perspective on the medical system having been friends with her because I
Oh
hear a
yeah.
lot of her feedback and what she says is that I don't think it's her pay, but like her feedback for everything she does is based on like um customer reports,
Mm.
what is that called? Like patient surveys, like
Yeah, there's no doubt afterwards or like, yeah, get
yes.
that info back that way.
And since she's in the ER, which the Pit does a fantastic job at explaining this rhetoric, so I know that I'm
Okay.
not going to explain it very well, so watch the Pit.
Okay.
But because all of her feedback is driven by those patient surveys, it's usually really negative feedback
Hmm. Because you're in the
because okay, number one, you're in the ER. Number two, Do you know like the wait time, the average wait time for people
Oh,
waiting in the ER these
geez.
days?
3 or 4 hours probably at least.
Way, like
Even more than
way
that.
more. Like I think minimum is like, or average is eight
Oh my gosh.
hours where you're waiting. And so that's just the average. And it's gotten a lot worse since the pandemic. I don't really know why. I'm sure that there's a lot of information out there as far as why, but
Yeah.
it's just bullshit. And then
So
the
of course nobody's
hospital,
happy.
no one's happy, and the hospital, you know, tries to get their ratings up so that they get funding. Like it's just this weird consumer built platform healthcare is. And
Yeah.
so I don't know. I know that we aren't like me and you don't aren't paid like that, but I do know in the healthcare that there are some like professions that have to do with patient care
Satisfaction
surveys.
and
Patient satisfaction, that's exactly what it's called.
yeah.
So, yeah,
Mm,
it's bullshit. Anyway,
yeah.
back to
Yeah, that was pretty much my grad school experience.
back
Yeah.
to you.
It did, I will say, some of the joy of finishing grad school was the like being done with it, making it out. Not everyone got through the program. Like
Yeah.
we had 5 or 6 people drop out either from grades or
Mhm.
they decided they didn't want to do it anymore, that kind of thing. So like the achievement of getting it done and like for me, since I found it all the way back in high school, and
Yeah.
it was like a definite special interest hyperfixation for me
Right.
that like finally achieving that was both like a really joyous thing and like, okay, shit, what next?
Yeah.
kind of thing.
Totally.
Yeah.
How cool. Do you like, are you happy that you did it? And happy that you like, yeah.
I mean, in ways, like I'm glad that I followed through on something and I did something so great. Like it's really cool to be able to say, like, oh, I have a doctoral degree. That kind of thing is really awesome. But I wish that I had known about my diagnosis before finding the career in general. I wish that I had not picked a human facing thing with so much pressure on talking to people, educating, being able to code switch between different patients. And like, I love being able to help people. And that's why I went into it, is because I wanted to help people. I wanted to help
Yeah.
kids, especially. Um, and I love that aspect of things, but it also is very hard for me.
Yeah.
Yeah.
That totally makes sense.
Yeah.
And it's like how are you supposed to go back in time and make a different decision? Like
Yeah.
it is just this other path that you have taken.
Yeah.
And
When people tell me all the time, they're like, okay, well, you're still young, like you're only in your 30s, you can change careers. And I'm like, okay, great, but I had $100,000 in student debt coming out of school. I still have like 40,000 and I'm 8 years out. Like,
yeah,
I don't feel like I can go back to school for anything, which means that anything that I switched careers in would be paying significantly less and like probably not any better job satisfaction because I can't qualify for the things that I do think that I would enjoy.
well,
So,
not only that, but we just talked about how school is very overstimulating for you.
yeah.
So would going back to another
I don't
program
want
even
to,
be,
yeah. Because I thought about teaching is
yeah,
I love taking students. I love teaching, like that aspect of things. But the problem is they want you to have a PhD to teach at almost every PT
but
school.
aren't you PhD?
DPT, Doctor of Physical Therapy, a
That's so
doctoral
fucked
degree.
up. Are
Yeah,
you
in case you don't know
serious?
this, a doctoral degree and a PhD are different. PhD, I don't know if it's technically above it, but it's like the research-based doctoral degree. Yeah,
Academia is so fucked,
it's
dude.
so wild. So like I would love to teach, but I'm not gonna go get a PhD for it. Like even if they
No.
paid for it, it's not that. It's that I don't want to do research again. I did research in undergrad and I didn't really enjoy it. Like I don't want to do research. I don't want to do that much studying. Like so that was kind of out the window.
Yeah. Well, I wonder if there ever will be an avenue for experience. Like you have your DPT and then you have, 20 years of experience. Can that qualify you to teach? Because I know that there's a couple of teachers at my program, because it's the same with speech. You're supposed to
Mhm.
have your PhD in speech to be a professor. But there were quite a few, I think there was two teachers, so not quite a few, that had their masters, but then they had a lot of experience behind them. So they were able to like hold a temporary teaching job. I think also our program was pretty desperate for teachers, so maybe
Yeah.
that's part of it too.
I mean, yeah, you
But
get to find a place that's desperate enough, you might be able to get in. So,
yeah.
yeah,
Oh, you make
yeah,
a wonderful teacher.
yeah.
Yeah, you're welcome. You're
Which is
welcome.
crazy because it's still like people facing, but it feels very different to me. Like it feels more like using my like special interest
Yeah,
versus like trying to navigate someone's health, which is more emotion based.
sure.
Yeah.
That makes a lot of sense. I've found myself in a teaching role at my job, which I'm not like loving. I don't love teaching, but
Mm,
what I do love is that it's very I mean, I have my routine down. It's
mhm.
very the same every time, and it's scripting a lot of the time too. So like
Yeah, that's super helpful.
they're my easy days at work, even though I don't love them. So, which
Yeah.
is just funny. But
Kind of funny. My mom told me after, like, it was probably a few years after I graduated and everything, but she was just telling me, like, oh, yeah, like most of our family ends up in doing things in numbers.
yeah, you said that.
Yeah.
Yeah.
And I was like, why couldn't you have told me that like so many years ago? I could have, like, I could see myself doing like accounting or something like
Mhm.
that.
It is so funny that there's so many ways to do life and to make money and to just however you want to spend your time
Mhm.
working. And then, the whole mentality of like, is working everything? And is
Yeah.
that my identity? Or is it actually like everything I do outside of work? And
Yeah.
that's been like a huge, huge part of my experience, but we can get into that later. Um, but yeah, numbers seems to do very well with the neurodivergent
Yes,
folk.
there are a good number of software engineers and similar as well. So tech
Hmm.
world, numbers, yep.
Yeah. So I also wish that I had figured out my diagnosis before all of it. I think that it would have made everything a lot easier. And it's just a bummer that that usually these experiences that are very heightened and do overstimulate you are the ones that kind of put you into that diagnostic category where you are either in autistic burnout or the thing that used to be easy for you is very challenging for you. There's this phenomenon in new parents where a lot of new parents are diagnosed with
Mm,
ADHD and or autism once they've had kids, and it's
mm.
like because they're in that like
Okay, so even
really
early
hard.
on, because I know there's a lot of people that find out like when their child is diagnosed that they then themselves
Yes.
find that out. But even
Yeah.
early on, it sounds like,
Hmm.
yeah, just from the stress of early parenting and
I wonder if it's a lack of introspection skills. I think we've talked about that quite a few times on this podcast, but it's like I didn't even really know a lot about my brain and how I went about the world. And so even if someone were to tell me, like, you're autistic, you're ADHD, you're about to go into graduate school, and like being a graduate student with those is very challenging for X, Y, and Z. Like, I would have no way of like taking in that information and making the decision not to go.
I was gonna say that too. Yeah,
Yeah.
because I feel like, yes, it would have been amazing to have known then, but I also feel like I've matured
Hmm.
now to a
Hmm.
point where I understand things better.
Yeah.
And I also don't think that I would have changed it because I was so set on it. Like,
Yeah.
I don't think that I would have changed my mind.
No.
Yeah.
And like, even with the testing barrier that you talked about, I mean, I'm sure that you were just very determined to do it no matter what
Hmm.
and get through it. I mean, that's just
Yeah.
how you do life, right?
Mhm.
Especially in our society. So,
Yeah.
yeah. Well, thank you for sharing. I'm sorry it sounds like it was just a very scary time and just a lot of unknown happening in your body and not knowing what was happening and just
Yeah.
getting
I'll
through
say one
that.
more thing on it because it this affects a lot of areas of my life, but frequently when I go through something stressful or hard, like the Appalachian Trail, like grad school, that kind of things, I usually get back and I look back afterwards and I'm just super disappointed in myself for how I handled things or how I reacted in those moments, which like I try to give myself some grace for because I'm like, you didn't have control of that. Like you were in this burnout or overstimulation that you didn't know about. And
Yeah.
like, of course, you reacted with emotions or
Yeah.
yeah, just not the way that I would have liked to handle things. And that's really like disappointing to look back on.
It's
So
really
I'm like, I didn't
sad.
really like myself in
Yeah.
grad school.
Yeah.
Yeah, that's really
Oh,
it affects a lot of areas of things for me. But
yeah. Disappointed because you're not proud of how you handled yourself.
yeah,
Yeah.
yeah, I'm not proud of how I handle myself. And like, yeah, like I said, I just didn't really like who I was in that time. Like I wish that I had shown better sides of me.
I can relate. And it's also like a really hard position to be in because
Yeah,
it's like you did the best that you could. Do you
yeah.
believe that you did the best that you could with what you were given at the time?
I think so. And then, like the looking back on it too is with the like in a state of not being in that emotional state.
Yeah.
Now being in a steady state, looking back on it, I can say a lot of things about like how I would handle it now, how I would handle it now, with all of my knowledge and all of that. But
Yeah.
there's no saying that that would have changed either because it was an emotional state. So,
I mean, that would be really hard to feel like there's still that person inside of you that went through all of that. And then you're like constantly like disappointed in them and how they handled things. Does it put an
yeah.
extra pressure on you now to like handle things differently?
I think so. Yeah. I mean, I definitely consciously try to handle things differently now, but
Yeah.
it's also a lot like what we talk about with like toddlers and parenting and stuff too. Of like toddlers only have a cup of energy to use. And if they're using all of that energy on the emotional state that they're in, they're not going to learn anything. They're not doing anything constructive in that time because the emotional state is taking up all that space. And like, not to compare us to toddlers totally, but like the things that I've learned from that kind of apply to me. Like if I am in a hypersensitive state or overstimulated or something like that, most of my cup is taken up. And so like I only have that little bit of energy left in there to manage how I respond, to manage my tone, to manage facial expressions, like everything else. Mm,
Okay, so maybe what I'm hearing is that graduate school for you, even though you weren't diagnosed or anything, you were still autistic,
yes.
still ADHD, that it put you in this like very hard experience where because there were so many demands, because it was so much on your shoulders, because there was so much to work through socially, academically, navigating all these unknowns, it put you in this like flooded state, which we talked about last week as like demands. And
Mhm.
so, yeah, that makes a lot of sense that it was just challenging in the way of not being able to mask, kind of. Is that maybe part of it?
Yeah, not being able to mask and not being able to just manage those areas. Like I
Yeah.
was focusing all my used energy on managing all those other things that you just listed.
Hmm.
And there wasn't much left to manage the other things. So that's why I say, like, looking back on it now, I don't know if I would have reacted any differently
Hmm.
because I didn't have the spoons, the energy, the cup left
Sure.
to have made that difference, even if I knew about it. Mm,
Well, you also didn't have the tools that
yeah,
you have built up
absolutely.
now, and you also didn't have all of the knowledge of how to rest or restore all of that. So,
Hmm.
yeah, it's hard because I see that like in hindsight, it's so easy to judge ourselves and like how we
Yeah.
handled situations and how we didn't know the information at the time. It was so obvious looking at us straight in the face, but
Yeah.
yeah, hard to integrate.
Yeah. And when
So,
people talk about like what difference does diagnosis make, it's that. It's that could I have reduced that most of my cup was being used up by school stuff, by using compensations, by using, you know, accommodations like wearing headphones or something. Like, could I have used those other skills to reduce how much of the cup was being used,
hmm.
which would then have left more energy in cup for
Hmm.
managing those things?
Yeah.
Maybe. We don't know now. But yeah, I agree.
Not about to go through it again to
Nope,
see.
not doing a scientific experiment on that one.
Wouldn't that be fun?
Yeah. But I think yeah, it's just like you said, that it's very accurate.
Hmm. Yeah, I think that academia does not do very well in supporting neurodivergent students, especially at the upper levels. I think that um, you are very much expected to mask. You're very much expected to like get through it no matter what at all costs and not be accommodated for. I mean,
Mhm.
yes, there is like an office of accessibility. However,
Mhm.
like I can talk about my experience and how I was accommodated as an ADHD student, and those accommodations did not help. And like it ended up being some physical accommodations that helped more for my ADHD.
I
Um,
think there's two big things with that. There's one is that we're not expected to be there at all.
yeah,
Like they don't expect us to make it to
yeah,
grad school and stuff. Like even on my testing when we talked about diagnosis, they were like, "Oh, you went through school and you did grad school and blah blah. Well, you must not be diagnosed." Like we're not
yeah.
expected to be in that space at all. Point number two being that we have an invisible disability and these accommodations and like offices and departments and all of that stuff are based around visible disability.
You're so right.
Yeah.
There's not enough education on what um
And what our invisibilities are.
what our invisibilities are. There's not, and what's really fucking ironic is that like I literally was in classes to learn about autism and then was expected to accommodate my autistic students, my
Hmm.
autistic clients that would be coming in. And I'm going to get into my story, but it's like I would be in conversations with my adults or other professors and be like, this is really hard for me. And they were like, tough shit. And
Yeah.
it's like,
And it's true with
what
like,
the fuck?
yeah,
Like, we
I'm,
literally just talked about this in class today,
yeah,
how we're supposed to honor the whole person. How the fuck are you not honoring my whole person?
yeah. That's so true. And I'm blessed with the coworkers that I have now have so much knowledge. But like sometimes peers in the past have done that where they like again code switched where they were like, oh, taking care of this person and we care so much about them and accommodating their needs and all that, and then turning to you as a coworker and being like, why the fuck aren't you finishing your paperwork?
Exactly. Like it
Like,
follows us right into the professional world, and you are so dead on about that.
yeah. Mhm.
Yeah. Like grad school was kind of a taste of the ableism that the real world brings as a professional. I look back at grad school and it is for sure the hardest thing I've ever done and have gotten through. And I have very similar like feelings that you have of like, I'm not really happy I did it. And that's been like a very big thing of my grief this year is just kind of living with the fact that I did it. It was really hard. And like, I think just because of a combination of a couple of other things that have been going on this year, I wasn't really able to properly celebrate even it having
Mm.
ended and getting beyond that. So, anyway, just like I've had a very weird experience with grad school, but I would really love to talk about a few things about being like an ADHD student that I see in hindsight now. I tried really hard to get through the program with like accommodations in place, and it was
Mhm.
still super hard for me. So it really did start with um, getting my ADHD diagnosis at the beginning of graduate school because as we talked, earlier, there was a lot of things happening at once where all of a sudden I was expected to turn in assignments weekly and meet with groups and do tests and kind of all of the academic things that went along with it. And our program started off not with a practicum at the same time. Which I think was a really positive part of the program. They kind of
Mm.
titrated it in. Um, but with that ADHD diagnosis, that allowed me to get accommodations. However, the way that at least our Office of Accommodations worked is I had a meeting with them and they basically asked me what I need, and I had no framework to work
Mm.
from. Like I had never had accommodations in an academic setting before. Um, I wish that I would have almost been given like a checklist of
Mm.
things to have checked that like could have fallen under. That's the other
'Cause
thing is you have to have certain diagnoses in order to get certain accommodations. For example, like I mean, I could come up with examples, but you were gonna say
I
something.
was just gonna say, yeah, and you don't even know like what the possibilities are
Yes.
going into that. So like a list would have helped to understand like, okay, maybe you can't accommodate this thing.
Yep.
This would be useful for me, but not that. Or
Yeah,
mm,
exactly. So one of the first accommodations I got was extended testing time,
mm,
which it sounds like that would have helped you out a lot.
potentially, yeah.
Yeah. I'm someone who's always been like the first person to finish tests
Mm.
in all of my academic career. Like
Do you have super reading speed?
super reading speed, super processing speed on the paper, not in everyday life.
Mm,
Um, And I think that's where my ADHD comes in, where it's just like, okay, I'm over and done with it. I'm moving on to the next one. And I do not hyperfixate on my answers because I will change them. And I have learned that I will usually change them to a wrong answer.
mm,
So I fly through the tests and do pretty well. So that's always worked for me.
mm.
So I got that accommodation, which like gave me double the time to take tests, which helped with like stupid things like quizzes and stuff that were 10
Mm.
minutes and 10 questions and whatnot. So anyway, that was weird because that was something I didn't really need. And I also want to say that all of our tests were online
Mm.
and we were taken at home in our own home environment. So
Okay.
nothing was at school. These were all in our own times, and that was a result of the COVID pandemic. So
And
I
mine was pre-COVID, so all of ours
exactly.
were in classroom and yeah.
Exactly. So I didn't have any accommodations in terms of like test centers or like you need to take a test in a quiet environment. I always was testing in my home, not around any classmates.
No scribbling
Um,
paper, no
yeah,
coughs, no nothing. Yeah.
exactly, exactly. And then my other accommodation that I decided to like speak up about was having a note taker in class because, yeah, I don't really remember why I had a note taker that helped with my ADHD, but like,
Are you someone who can't like write at the same time as like listening? Like how do you process your learning?
I don't think I learned
Okay.
to this
She's never
day.
learned ever once. No, I'm just kidding. No, you just haven't learned what you're processing. So you don't really know like what your learning style is. So then, because I feel like that could help accommodate if you're someone who only learns like verbally or visually, and then taking your notes is like distracting you from that.
Yeah.
Whereas like I learned through writing
Uh-huh.
kind of, so I had to be able to write, but it would
Sure.
have been nice to have been able to catch up a little faster because
Sure.
usually I was like
Yeah.
speed scribble. Yeah.
True.
Yeah, yeah.
Yeah, let's be honest. Like I was pretty much in fight or flight my entire graduate school experience, like
That's a good way to put it. Yeah.
from the beginning. So my argument is was I even learning anything? Because as we know, you don't really take in extra input when you are in that fight or flight response. So
Hmm.
I clearly passed the tests and I'm clearly here at the end of the 2.5, 3 year program. But did I learn week to week? I don't think so. I
Mm.
don't think so.
Just a lot of memorization and then
A lot of
forgetting it.
memorization, a lot of forgetting it, a lot of like learning at my practicums. And
Mhm.
I also had this accommodation that was very strange to me because when I talked to the Office of Accommodations after I got my ADHD diagnosis, I told them, what I'm really struggling with is turning in assignments on time. And
Mm.
procrastination is something that my ADHD is really like that's what I'm really seeing is that I'm procrastinating a lot.
Mm.
And their answer was like, well, we don't really have an accommodation for that.
Okay.
So like pretty much buck it up and do your work and don't procrastinate, which cool, super.
What do you think would have helped you most with that?
Well, I did get an
Oh,
accommodation that was to if I'm not able to turn in an assignment on time, I'm supposed to email my professor and tell them when I could turn it in. So like I was supposed to let them know 24 hours in advance of the due date that I hadn't completed it and that I would be able to ask for like a couple of days extension.
Mm.
But that doesn't really work for procrastination because if you're at the point of like 24 hours that you know you're not going to get it done, if I knew 24 hours in advance that I wasn't going to get an assignment done, I probably would get it done within that 24 hours.
It requires you to know when the date is and also like preemptively plan to email and like that's a lot of pre-planning for something.
It's a lot of pre-planning and that doesn't work with ADHD or
Yeah.
like the nature of the disability part of things. And also like I could get an assignment done in 24 hours, I guess is what I'm trying to
Yeah.
say, like especially working under pressure and like it just felt really silly to me and I felt like I only used that accommodation a couple of times because I was just like this is embarrassing for me to be like I can't do it. I'm gonna get it done I with like 3 extra days when in reality like I could have just sat down there and done it at that time.
Mm.
It was weird. It was like an accommodation that made me not procrastinate because of the shame.
Yeah.
Does that make sense? So
Yeah, I hear what you're saying.
it just was it was one that I didn't end up using, but at the same time like the procrastination was something I very, very much struggled with.
Mm.
And so as time went on with accommodations, I talked to one of my friends who had POTS, one of my good friends in the program, and she had different accommodations for hers
Okay.
that was like you can email at any time and get a week up to a week extension on any assignment. You don't have to like let the professor know ahead of time. You can just know that you have a week's extension on every single assignment. If you're in like a POTS episode, and then when you turn in your assignment, just like let the professor know. And I was like, why isn't that an accommodation for ADHD? Like
Right.
that sounds way more workable with that disability. Um,
Interesting.
so it was just like frustrating because why could a physical disability get the same like accommodation that could work just as well for ADHD, but because it's like an invisible disability, it's treated differently.
Yeah.
I see that it's treated differently.
Well, and that brings up an interesting point too about like, does it matter when you're diagnosed? Well, these processes take a really long time. Like you're going through testing now to find out if you have POTS, to find out if you have, all these other health,
Oh, me
yeah, comorbidity,
personally?
yeah, like comorbid things that go along with it.
Well, that's
And
the
so it's like if you had been diagnosed when you were 12 and it takes 3 years to get all these other diagnoses,
yeah.
would you have had more physical accommodations then too? But like,
So true. Well, so at the time in grad school, I very much blame grad school for like all of my chronic illnesses. Like I know that it
mm,
made me sick. And like looking back, I definitely had symptoms, but it wasn't enough to like inhibit me from doing my work.
mm.
Um, luckily. Um,
So you just got like a super stress flare, and then that flare like launched other things or like worsening of the some things that you already had.
it's so hard to look back and think about like what my physical body was doing at the time. Like
Yeah.
I know I had migraines. I ended up getting accommodations for that, which I'll talk about in a second. But the POTS symptoms that I started experiencing after graduate school, I honestly feel like I have been experiencing them all my life, but have not had, again, those skills of reading what was
Mm.
going on in my body. And this was like because of POTS. Does that make sense? Like,
Yeah.
I always blamed it on exhaustion. I always blamed it on I'm not drinking enough water or
Mm.
like eating enough.
Yeah.
Yeah, there's no way I would have even been able to be accommodated for POTS because I didn't even know that I was experiencing it at the time. Does that
Yeah.
make sense?
Yeah. But that's kind of what I'm saying that like if you had been diagnosed earlier, like would you have been given the language to kind of say like, oh, can I tell this in my body? Or like, like early
Yeah.
diagnosis really does help with finding those things earlier on.
It does, and I think that that's a great way of putting it is like that's kind of the reason for getting diagnosed is you're able to put the language to all of these experiences and
Yeah.
sensations happening in your body and in your
Especially as a kid, because you
experience.
have no idea. Like I feel like I was a kid
Nothing.
until like after grad school, honestly. Like I still think of that as like little me.
Yeah.
But yeah, we didn't have the words or the language or any of that to
And that's one of the reasons why I really admired my friendship with this friend who had POTS is she taught me so much about disability and the
Mm.
nature of friendship within disability and honoring people as they are. Um,
Oh.
so I'm so glad I met her. I'm actually having coffee with her today, which I'm really
Oh,
excited about.
I love that.
But yeah, I know that we've like gone kind of on like a another part of things here, but it is just interesting how ableist the system is of not really understanding how to accommodate various disabilities, not having a lot of understanding of what they even are, how they present differently in folks. Like it's just not a one fix all accommodation is going to help every single ADHD student.
Yeah.
Um, so when I got my migraine diagnosis from, and I don't even know if I was experiencing migraines, I basically just got a headache every single day.
Oh.
Now I almost wonder and know that it was a way of my body telling me I was overstimulated.
Oh, okay.
Um, so because I had that accommodation in place, which literally was just a doctor visit and her telling me that she'll like write a migraine prescription or
Okay.
whatever.
Yeah.
And then I brought that to the Office of Accommodations, and then they were like, oh, well, we can do these accommodations. And they had a list
Oh,
for
for the
the
migraine?
migraines, but not the ADHD, which is just silly to me.
Yeah.
So that's when at
No.
that point I was able to get the accommodation of like not having to communicate beforehand
Okay.
that I wasn't going to be able to turn in the assignment. So
Yeah.
it was just interesting. And then working with professors from that moment on felt it was just treated very differently. But I did get in lots of trouble throughout graduate school.
Trouble.
Oh, yeah.
Oh boy.
And I do think it was because of my autism. This program started with the rhetoric of you belong here, everyone belongs here,
Mm.
and really set forth this rhetoric of belonging, which I think is really toxic for a graduate program, to be honest.
Hmm.
Um, because rather than encouraging you to kind of like belong to yourself and have confidence in who you are, it's like always looking for that external belonging and that like
Hmm.
we're a community, we take care of each other when like that's not what this program does. They
Hmm.
take care of people that don't disrupt the system. They take care of the people that stay quiet, go through the program.
Hmm.
So it started off with another student and we had become friends because she was ADHD and had disclosed that to me around the time that I was being diagnosed with ADHD. So
Hmm.
she was very helpful and supportive in terms of like, this is how it manifests for me. Like, this is how I study. This is what I think she even told me what accommodations she had. So very helpful. And then we were studying for finals over winter break or like right before winter break. And she was like, by the way, I'm really Christian and don't approve of your lifestyle.
Oh, oh no.
Like straight up, we were in a coffee shop and she was like, yeah, and your partner is non-binary, right? And I was like, yeah. And she was like, yeah, I don't believe in that and I don't think that's true and I think it's like a mental health thing.
Oh my
And I
gosh.
was just like, I'm like totally getting the feeling of the experience it was, but
Oh my gosh.
it was super shocking. It felt like it came out of left field and I didn't know how to manage that experience at all and immediately like went into fawning and was just like, how do I get out of this experience? Like, how do I get out of this coffee shop? How do I leave? And she's just
Hmm.
like berating me on all of this. Like,
Oh, she didn't stop either.
she
Just
didn't
like,
stop. She just kept on going on. And like, it felt like she was like talking herself just around in circles of like, yeah, these are my beliefs and whatnot. And I remember just being like, okay, well, I'm gonna go. And she was like, but we can still be friends, and
Oh,
like offered a hug to me. And I was like, mm-hmm, and hugged her and left
oh,
because I think I was in such a state of shock and not understanding like what was even happening. Like, this was my first face-to-face homophobia, transphobia that I've ever experienced. So I got home. I was super shaken. Again, this was the week before finals. I was just like flooded with this whole emotional experience of processing what had just happened, not knowing who to talk to about it. I met with my advisor, told her about the experience. And then that turned into a meeting with the director of the program about what had taken place. And she was like, okay, well, we're so sorry this happened to you. Like, what do you need from us as support? And I was like, I don't want to ever work with this classmate again. Like, I don't want to be near her. I don't want to interact with her at all.
yeah.
And I also want an apology. And she was like, well, we can't do anything about the apology, but we can make sure that you guys are never in groups and that like, we can talk to her about not, like, talking to you
Mhm.
essentially. And so it was like this experience of like feeling heard, feeling seen, and then I get back from winter break and I had taken my finals, all of that stuff. Got home from or got back to school from winter break, and like within the first week, she was in a group of mine. And
Mm.
I went up to the professor and I was like, hey, I'm not supposed to be in the same group as her. And she was like, well, I haven't heard anything, so you're just gonna have to like stick with it.
Oh,
hmm And then I talked to the director and she was like, yeah, well, I know I told you that we could do that, but it's just going to be really difficult for us to like make that happen. And mind you, this was a class of like 35 students. Like it could have been
yeah, there could
very
have been different
easily
groups.
handled.
Yeah.
Um, so then I mean, I was just activated at all times. And so that's what started this whole relationship with this director and not trusting her.
Mm.
Um, and then that winter semester was when I had to take a breath after that story.
Yeah.
That was a hard story to tell.
Yeah.
Yeah. So then that winter semester when we came back and I was in groups with her was also the same semester that we started our practicums out in the community. So this is when we worked as SLPs at schools or different medical settings. And I was at an elementary school. I was placed there and was really just thrown into being an SLP. The teacher that I worked for did no modeling of
Oh,
anything.
jeez.
She basically was like, yeah, so this is your caseload, so this is what you're gonna do and do it.
That was your
And
first case.
it was my first time doing this, and I was just like, what do I do? And looking back, I just had no knowledge of how to even go about that experience. Like there was no roadmap for go to your advisor or have a conversation with her and say that you're not prepared. Like I just had no roadmap to work from. And I see that as an autistic individual, I really need that roadmap and clear boundaries, clear directions for how to do things. And
Yeah.
um so that was really hard socially, a social thing. And
That just sounds like bad teaching. Like
she
that
was a
person
horrible
shouldn't be
teacher.
taking students, which I ran into that a lot too. There was a lot of
Yeah.
people that would take students to have extra hands
hmm
so that they could do their notes or they could do whatever else, and it wasn't a teaching experience.
Better than that, she was opening up a private practice. So she was working on that
A separate
a
job
separate job
while you were doing her
while I
job.
was doing her job at the school.
Whew,
Yeah.
that's messed up.
Isn't that so fucked up?
Yeah.
So fucked up.
Yeah.
So,
I would never throw like, because I had students everywhere from their first rotation to their fourth, because our PT schools usually do like four-ish
mhm,
rotations. It's like your first rotation, you're like barely touching patients. You're not
mhm.
You're not dealing with somebody the whole session yourself at all.
Hmm.
Like the way that your first one should be is like very much you watching for the first like few days to a week.
Hmm.
The next week you do a couple or you do a part of their treatment
Hmm.
a whole time with somebody right there with you.
Hmm.
Yeah.
Yeah. So I had a later practicum that did that.
Mm.
And anyway, like
Then were you just like, this is what it's supposed to be
that
like?
was what it
Oh.
was supposed to be like. And it was like, it was so helpful. And I was so grateful for that, again, titration of
Mhm.
like, you are learning, and this is how you kind of learn at different stages. And we had very open communication throughout the whole time. So this first experience wasn't that at
Yeah.
all.
Mm.
And I was seeing a ton of students at a time too. Like I saw 2 to 3 students where like I didn't know that we did therapy in multiple groups. And it was really, it was really hard. And I didn't have a lot of friends in the program because I had just gone through this homophobic bullshit where
Yeah.
I was just like, okay, my one friend that I've made like has turned out to be a nightmare. I don't really want to open up to anyone else.
Yeah.
And that was when I started hanging out with my friend who has POTS, and she was also having a very hard practicum where she would it was sounded very similar to my experience, and same thing where like her preceptor would leave and like leave her in the room to do the speech therapy with the kids, and luckily mine never left the room. She
Yeah.
was just constantly at her desk working on other things. But this friend told me that she was in talks with her clinical advisor of like talking through this problem and how it was to be fixed and whatnot. And
Mm.
so I was like, okay, well, maybe I'll talk to my clinical advisor about what's going on. And so I talked to my clinical advisor about what was happening, and she was like, yeah, well, that doesn't seem like it's a very helpful learning environment. But it does sound like that's how she teaches, so you'll be done with this practicum soon. And just like completely ignored, which
Oh.
was so not what I expected. And so I was just like, okay, well, this is the norm. Keep going with it. And like basically feel like I can't really complain about what's going on. So whatever. And then it turned into like me having panic attacks, really bad
Uh,
ones, because I was just feeling like everything was so overwhelming. It was so unethical what she was doing. And my worst one happened about 2 weeks after I had had the clinical advisor appointment. And I ended up leaving the site because I couldn't calm down. And um, I texted my preceptor because we had been texting. That's how we communicated primarily, and let her know that I wasn't coming back because I was having a panic attack. And she was just like, you can take care of yourself. Like, don't worry about it. And then I get a call from my clinical advisor the next day and was like, I heard that you left your work site early. And I was like, yeah, I was not doing well because of X, Y, and Z. And she was like, well, this is a really big problem and we're going to meet on Monday. And I ended up getting like a behavioral slap on the wrist essentially, but it was like a letter
mm,
served to me from my clinical advisor and the director basically saying that like I had handled the situation inappropriately, even though I didn't really understand what I did wrong. I still don't really understand to this day because they said that it was based on how I communicated that I was having a problem with
mm.
the preceptor and like how I communicated my panic attack. I really need you to tell me how I can do it differently next time. And they didn't really offer that side of things. They
Yeah.
just kind of said, you did it wrong.
You should just
Shame on
know.
you.
Yeah, you
Yeah.
should just know how you,
Hmm.
yeah. Like, because
Yeah.
it's very much framed in like a you did this on purpose
Hmm.
kind of way for people a
Yeah.
lot of times. And like our lack of control of what's happening in the
Yeah.
moment of that panic attack or whatever is happening
Hmm.
emotionally isn't necessarily in our control
No,
to
it's
be able to be
not.
like, oh, I'm gonna purposely leave this and like communicate badly. Like we don't know what we're doing. Like we
We don't.
and yeah, like, it's like not a roadmap to what you should be doing instead.
Mm-mm.
Mm,
No roadmap except be professional. Like, just be professional next time. So I didn't end up passing that practicum.
Mm.
So then I was like behind in my whole experience. We were a group of graduate students who just like, there was just a lot happening in the world, and our program was not communicating. So that summer was when Roe v. Wade was overturned. And
Oh.
also there had been like a couple of shootings at schools, and there had
Mm.
been something else that happened where, like I said earlier, their whole rhetoric was you belong here, we're a community.
Mm.
And so, I take that at face value because I'm autistic, and I think
Yeah.
a lot of other people did as well. Maybe not because they're neurodivergent, but just because it was like this rhetoric pushed through our whole program.
And a lot of times you choose things because there's not a lot of differences between programs really to know besides like cost and what they say.
Hmm.
It's like you may have chosen that program based on that.
Yeah,
Like,
it's so true. It's so true. It's like a marketing
mm-hmm. And you'd
play.
expect them to hold up their end of what they say.
You do. You do.
Mm.
So we had complained just that like they didn't say anything about the Roe v. Wade
So more than
thing.
just you, like it was
It
like
was more than
multiple
just
people in the
me.
group.
It was
Yeah.
multiple people in the group. It was our leadership group. And like, I remember that we all had a meeting with our director. I said, like, why didn't you say anything to us as a program? And she just like launched into this whole thing of like, no one asked me where I was, where I heard the news, and you all expect me to like be here for you, and like you are all adults and capable of getting through this, and yada yada yada, and like just full on elevated yelling at me. And I was just like, I don't even understand like what is happening right now. I literally just asked you like why you didn't
Yeah.
do
And
this.
you just told me to be more professional.
Yes, exactly.
You
Exactly.
had a program, like you've got the responsibility to care for all the people in your program.
You're a fucking leader.
Yeah.
Lead. Yeah. So it was a nightmare. And
Mm.
then like she came after me with an academic hearing because I was turning in assignments late. Even though I had the accommodation in place,
Mhm.
they were able to say that I turned in like two assignments past that week long thing. I know that this is because she yelled at me in that meeting and I
Mm.
triggered her, and that she was like just
It was
really,
directly after.
yeah,
Yeah.
it was like 2 days after this meeting. And so because I had turned in like two assignments past that week long thing, I was warranted an academic hearing. And it was just such bullshit because I was getting passing grades in I was getting good grades. I think I was getting like A minuses or something. But because I had turned in a couple of assignments past that accommodation, they, yeah, warranted a hearing.
Wow.
And
This all makes me really angry for you.
I
My
know
my
it's just
empathy
like
is
shit.
triggered.
But it's like one of those things where I don't want to sit, like, I know that I've sat here and complained for like 40 minutes. So I want to stay on track of like, but I think that because I didn't have a diagnosis, I didn't have a framework to work from in terms of being autistic, knowing how to rest, knowing that this was like a very activated experience that I was having, and I didn't know how to like go around the social norms of it all. Like,
Mhm.
it was very traumatic, and like things happened that shouldn't have happened. And by the time I ended up taking a break from school after the academic hearing because
Mhm.
I was just like, this is way too much stress, and this is not what, like, I just feel like this is so unfair how I'm being treated, and I couldn't even see past the red. Like, I felt like I was seeing red because I was
Mm.
so angry about the injustice. And so I took a semester off, and like, I think I just could have handled things so differently had I been diagnosed, had I known a little bit more about how I operated.
Mm.
Um, and Yeah, they had no idea how to work with someone who was ADHD and didn't try to understand. Like, I had one clinical advisor that was newer to the program, and we had one conversation where it just felt like she cared a lot and really did see me.
Mm.
And then a couple days later, I like went up to her and was just like, I really appreciate the conversation we had. And she was like, I can't talk to you anymore about those things. And I think that she got in trouble for like
Uh,
having an understanding conversation with me. That's
mm,
just kind of what it felt like.
mm.
Um, so it was just this really weird, toxic program.
Ugh.
Anyway,
The imbalance, and this happens in like different areas too, but the imbalance of people telling you, reach out for support. I'm here if you need
yes,
me for anything. These are your pathways. Like even if they do give you the pathways to do, and then doing the opposite when you get them, like even the very basic like asking for, is this normal in a clinical education and saying like this isn't working for me, and then them ignoring that, even though that's what they said, like we're here for.
yeah, it's
And then, of course, that led to more things down the road. And then saying
mhm,
again that you didn't handle it right, even though you handled it by going to them in the first place.
correct.
Like, yeah, it just was a failure from the beginning.
It was.
But
And it was like, I feel like there's been so many experiences in life like that where it's like autistic folks aren't given an instruction manual for how to do X, Y, and Z, and then are completely like gaslit later on and
mhm.
just like you did the wrong thing. And it's like, how did I?
Well, there's like these broad understandings that we're just supposed to know what is being professional or what is, pushing through it. Or like, like
Yeah.
what are these things and like what's wrong? And that's a lot of times like where we get ourselves in trouble too, is that we don't know when to report something
Hmm.
because we don't know what normal is. Normal,
Correct.
like what is
Right.
expected. And
Well, and I'll
yeah.
go, sorry, what were you gonna say?
No,
Oh, I'll go one step further and be like, we see the world in a different way than neurotypical people and don't really understand why we need to be professional and like having that understanding of like, okay, well, if I need to be professional in this sense, like I don't know actually now that I'm talking about it, because I feel very rigid in my feelings about professionalism, and I feel like
mm,
our society is changing parts of professionalism, so it's very confusing to like
yeah.
not have those expectations clearly laid out, and if they are clearly laid out, like why they're still stuck in such traditional senses. Does that
Yeah.
make sense?
Yeah.
Anyway,
Mm, yeah.
super positive.
So you're out of that now. No more school.
Yeah, I don't think
Mm,
I'll ever go back to school. Which is disappointing because I love to learn, but at the same time, it's like I don't really even feel like I learned um a lot from graduate school. And I know a lot of SLPs feel that way too, of like a lot of what they've learned has come from
mhm.
continuing education, actually being an SLP and experiencing it. Um,
Yeah, I think that was a fundamental misunderstanding for me going into grad school, is that
mhm,
I had that expectation that when
mhm,
I come out of grad school, I'll feel confident in like all the areas.
mhm,
But really, even though our program was a good program, it prepares you for understanding the background of why things work and like the mechanics of things,
sure.
but not anything practical, like nothing that you
No.
use in your regular like practice and stuff. So it was a lot of that learning on the job and stuff. And
Yeah.
I saw several classmates going through not as bad of clinical scenarios, but very similar. Like one was at the same building as me with a different CI clinical instructor. And they did that like where they just threw them into everything, didn't help them at all, and like they were close to failing their practicum. Like and it was at the same building that mine was at, and mine was a
Yeah.
great instructor. Like
Right.
but the program doesn't really change that because they're in desperate need for instructors, so they try not to get on their bad side. And it's
Right.
just like this crazy social balance that they're trying to like walk that doesn't help anyone. Doesn't help the
It
people that it's
doesn't.
supposed to help.
It
Mm,
doesn't, and I think too, maybe what I would have appreciated,
appreciated.
maybe what I would have appreciated is if that professionalism that they preached so much was, you know, part of how they handled things too as a staff. And like,
Yeah.
I don't think it's professional to have this community based. I just think that the rhetoric of being of belonging and that like we're all meant to do this as SLPs and we all are part of this community, I think that's unprofessional and set up expectations that people would care.
Mm.
If you were in the community, you usually care about those in a community, and no one fucking cared. So, does that make sense?
Yeah. Mm.
I don't know.
Yeah. Well, it's not professional to say that you're going to give someone an accommodation, like not putting them in a group with somebody and then be like, oh, that's too hard.
Yeah, I
Like if
know.
there's anything that I've learned now, it's like getting everything in writing because people are
Yep.
not going to follow through on
Hmm.
things all the time.
Yep.
We have the best hopes for people, and I think that I see people in a positive light until
Mhm.
something happens, and then I'm like, oh, I see. So I don't feel like I see the potential for people like wronging me or something.
Yeah.
Like I'm pretty naive when it comes to how I perceive people and like benefit of the doubt kind of things.
Well,
Mm,
my therapist put it really good, or my therapist put it really clearly that like we take things at face value. So if someone says that they're going to do something for us or support us in one way, like how are we to believe differently because they have said the thing?
yeah.
So, yeah, it's
Oh.
definitely a sticky thing that my brain has a hard time working through.
Anything light to end
Oh, no. Well, I don't know. Like, one of the things I did want to touch on too is that, like, I went to graduate school to soothe a part of myself where I didn't have a lot of identity
on?
before going to graduate school. And I really did, I wanted to put a lot of my worth into what I did for
Mm,
work.
gotcha. Yeah.
And I know that it took the experience to teach me the lesson of my work is inherently
Yeah.
in me and who I am versus what I do. And that wins every time. And it sucks that it took this traumatic of an experience to bring that lesson to me. But I really wish that that wasn't the reason why I went to graduate school and the reason why I kept in graduate school. Like, I really wish I could have seen, and
It's a
that's
tool. Yeah. That
a
it's a tool
tool.
and not a value of
Yeah.
yourself. Yeah.
Yeah. And I'm really disappointed that, like, yes, what speech pathology has brought me is a lot of stability between being financially secure. Um, I feel fairly secure in my job right now as the economy kind of takes a turn.
And
And
we're always needed. So it's definitely, you have the job security of getting another job.
I
And
hope so. I hope
yeah.
so. We don't know what's happening with the school system right
Yeah.
now, so we don't know what's going to happen, but like I
But even
feel
in speech
pretty
in general,
secure.
like, yeah,
Yeah.
there's other
So
jobs in healthcare. And
exactly. But I
mm,
think what I'm wrestling with is I don't think that the stability that I have was worth losing all of the lightness and joy that I had before graduate school. Like that is really hard for me to access afterwards. And I'm sure that I'll get there. And I know that there's moments where I catch myself in that like lighter state of being. And I'm like, oh, like I can
yeah.
still access that person and that joy and that freedom. And I
Yeah.
really hope that that just continues on and forward.
Yeah.
But I don't know. I think my favorite part of graduate school was at the end of my practicum that I had in a middle school setting. And this was during that semester that I did have my academic hearing.
Mm.
It was kind of after the worst of it had happened. And my program had talked to my preceptor and was basically like, watch out for her,
Oh, okay.
which came out at the end of my practicum with her.
Mm.
Um, she had this conversation with me where she was just like, I am passing you, and you have gotten the highest score out of any of my previous students. I just want you to know that you are going to be a fantastic SLP.
Oh.
And it just meant a lot because she had been kind of a veteran of the program in terms of preceptors with, like a
Mm.
lot of people had been taught by her. So I knew to kind of
She was
take her.
known.
She was known, and she, I was like, did you know about all of the stuff that I was going through beforehand? And she was like, yeah, I had a conversation with your director beforehand, and she basically wanted me to watch out for you, and if she saw any red flags to communicate it with the program. And I was like, that's really cool to know. And she was like, yeah, so I didn't have any of those conversations with anyone. I just want you to know. So I hope that they start treating you better. And so I feel
Oh.
like she knew that I had been mistreated and just not understood for who I am. And, middle school, you work with a ton of neurodivergent individuals. And so I think she saw that in me and was able to just like there were a couple of times actually, now that I'm thinking about it, where she would turn off the lights and just be like, do you guys need the lights off? Like, it just seems like we need things a little bit calmer in here. And we would turn off the lights. And
Mm.
so I don't know if like she was neurodivergent or
You
could
could
just like
tell from her
it was
experience or
just
like,
weird. Like now that I'm
um,
thinking back on it, yeah. It was
I'm glad she
positive
gave you that
though.
confidence of like, you are doing a good job. Like,
Hmm.
this is not your whole being of
Yeah,
what they've made it.
exactly. So,
Oh,
it was special. Anyway,
yeah.
that's the positive note I think I will
Oh.
end on. Hopefully next time we'll be a little bit happier.
I don't know. We're talking about finances pretty soon, so I may not be
Oh,
happier.
God damn
Oh God.
it.
Hey, we stopped talking about reality when we said this podcast, right?
I know,
The
I
good and the
know.
not so good.
The great and the not so good, the
Yeah,
joyful and the whatever it is.
yeah.
Well,
So be unapologetically you this week.
and find your joy. Thank you, hotties.
Bye.
Bye.
Bloopity bloop bloop.
Bloopers.
And then on top of that being an invisibility.
Invisibility is a new word. It's my invisibility.
Um, it's our invisible disability status that like these accommodations and like offices.
Got it that you're doing invisible and disability
Yeah,
together.
it's a real word. One
Invisibility, it's my invisibility.
in my invisible disability, invisibility. Yeah.
So,
Do we want to
anyway,
backtrack a little to your
do
story?
you want to backtrack? Back, back.
That's my favorite verbal stem that you because I think every time we've said back, you do that one and I love it. Back it up.
Have you seen that trend on TikTok where it's like my vocal stems and it like does clips of like what people's stems are?
I love the ones that are based on like current people, like their responses. Like, not to say where my political spectrum lies, but the girl that does the like Donald Trump voices. It's just like we're throwing the left-handed people in the water. The redheads are getting run over by stones. We're gonna
Oh my God. That
there's just like there's videos like that of people showing their verbal stems of that person. So it's like
is so
three copies in one.
funny. The one person. I definitely had this stim going when I went to Puerto Vallarta a couple of years ago of him going, Puerto Rico.
Puerto Rico.
And I couldn't stop. And everyone in the group was like, you are so fucking annoying. And
Just
I just like,
playing Cascadia. So the game we were talking about.
yeah,
So Lauren started this, and then apparently you did it too. That
yeah.
there's foxes in the game, and when the foxes the tiles get shown up, she cannot help herself
What
and
does the
say, "What
fox
does the
say?
fox say?" Dun, dun, dun.
Ding, 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 ding. You just
But
can't help yourself.
TikTok has ruined me in that way because I have so many new stems from it. Like hot
Yeah.
dog macaroni, chicken.
Brony, chilling with my homies. Chicken wing, chicken wing.
I'm a snake.
Oh my, yes,
I'm a
snack.
snack. Harry Potter, which that was all the way back to
That was like a middle school
Vines. Like,
sim.
yeah.
Yeah. Snape, Snape,
Severus
Severus
Snape,
Snape.
Dumbledore.
We could literally
Sidebar.
spend a whole episode
Just
going over
a
our
whole episode of
stims.
just stimming. I love that.
That cracks me
Okay,
up.
sorry for that sidebar.
Oh my gosh, never apologize for being, yeah. We're good here. Back it up.
Get up, yeah. Yeah.
I don't even know where that's from either. Like I just say it.
Oh,
I think it's a song.
yeah.
Back it up. Or maybe someone said that to me one time, but it's
It's
sticky.
in there.
Oh my God, another like echolalium is coming in. But have you ever seen Frozen 2
Yeah,
with Olaf and he's like, I don't have a skull
I don't have a
or
skull.
arms.
Yes.
I don't know how to learn.
Everything will be better when I'm older.
Oh my gosh, that is such a
So
good movie. Thanks for joining us this week. You can find us on Spotify, YouTube, and Apple Music.
please like, subscribe, and leave us a review. We could use some of those. If you want to get pictures that go along with our episodes and follow along, join us on Instagram and TikTok.
Thanks,
Thanks, Patty.
hotties.